Good evening, everyone. Today we have with us Dr. Ruhi Agarwala, who has joined us here from Bangalore. Thank you, Dr. Ruhi. She's a medical doctor who's specializing in functional medicine for the past 8 years. She's got special interest in women's health, a co-founder of a program called Hormone Reset Program, which has been run successfully. She's also a co-founder at a thing called Dr. Juice. She's got a very special interest in infertility. So today we are going to ask a few questions and she's going to enlighten us with regards to that. Dr. Ruhi, can you please give us a little about your journey?
Sure. So, after completing my MBBS, when I started working in a hospital in a neurosurgery department, that was my first job. It wasn't nice to treat patients when they brain tumors, right? All you could do was excise them and, it's symptomatic care. So that made me rethink if I really wanted to offer symptomatic care to my patients through the rest of my life. And I decided to pursue something which helps in preventive health rather than just symptomatic care. So that made me pursue a master's in global health, which I did in Netherlands. Then I had my interest in implementing innovations. So I was involved in startups which dealt with creating innovations which can make life easy in healthcare. And all this while, it was wonderful to see good innovations coming into the market. But then, if eventually we are still pushing patients into a system where they're still dealt with symptomatic care, we are not doing any different. This I realized a lot more when I was involved with the startup which is into breast cancer screening. Mm-hmm. And I was heading the public health there. So I was involved in a lot of large scale implementations for breast cancer screening. So I would witness a lot of women in their early 30s coming with breast lumps. Mm-hmm. And when you take a history, you also get to know that, these women have their uterus removed already. They're in their 30s and they don't have a uterus. And now it's painful to see young women with no uterus with lumps in the breast. And the only thing now they're told is you have a breast lump now, get it removed, get the lump removed. There's no education about why there's a lump in the first place, right? Or how you can prevent. So that again made me think, is this what I want to just keep doing? Working with innovations is wonderful, it's a buzzword, but then what difference is it really making in terms of, the bigger impact that, I always wanted to do? And in all this journey, I had my own diagnosis of PCOS, which made me look for answers. I didn't want to be on hormone pills. And so while I did my own research to find out solutions for myself, I came across clinical nutrition and then to functional medicine. And I did a course in functional medicine. I found the answers. I was able to recover from my own health issues. And when I started working with, as I said, large scale implementations, I see how it's impacting in a larger level. It was like I have to take this much more seriously. I have to bring it back to the women out there who need help, create that awareness on how they can actually balance their hormones, prevent conditions like breast lumps, uterine fibroids. Now, these are much later. Before that, a woman with a hormonal imbalance struggles on a daily basis, right? One only looks at fertility, but then it's about everything that they experience on a daily basis, their mood, their hair, their skin, everything.
Now, we have a huge they come the most common presenting feature we think is the PCOS or the yes. PCOD, but what you're saying is absolutely right. They don't sleep well.
Yeah.
They don't eat well.
Anxiety levels are high,
and they sometimes they are the main provider in the family. In married families, even in unmarried families, they actually provide for their parents. Yeah. So there's a lot of anxiety, stress related issues going on there, which is having a direct bearing on their health.
Yes.
In case of married, and they come and say, we've been married for 9 months and my in-laws are asking for yes. what's happening, and I honestly can't believe it. I mean, of course, if you're married for 2, 3, 4 years and you're not having a kid, yes, it's understandable. Mm-hmm. But these are the kind of pressures what they feel, and the subfertility. I mean, I'd like to use the word subfertile rather than infertile. Subfertility is truly an issue which needs to be addressed, and you're doing the right thing for that. How do you manage your patients who come up with these?
The first thing when someone comes to me and says, I'm not able to conceive, right? I ask them, have you asked these 4 or 5 questions to yourself? First, is your body ready to conceive? Are you eating well? Is your gut health good? Is your body free of toxins? Is your mitochondrial function good? If answers to these is not yes, you're not ready for a pregnancy. You will have to give that time and effort to prepare your body for pregnancy. Because often women, they're trying for pregnancy and it's more of a rat race, right? You try for a few months, you're not able to conceive. Okay, try IVF, try this, right? But you're trying all that, but you're just trying to somehow balance your hormones. You're looking at the lab markers of hormones. Okay, it's not in range, you have to try another cycle. But what has actually contributed to those hormones out of range? Have you looked into that?
To those abnormal hormones.
Yeah. Have you taken a step back and looked at what is really making those hormones, kind of go haywire? That's perspective is missing. So until we do that, we are just kind of, trying to play with the hormones still.
But that perspective is missing. Is it because the conventional medicine they're not ready to embrace that there are extraneous factors impacting on those hormones?
You're right. Yes. And I strongly believe as practitioners, we have to upgrade our knowledge. Right? Otherwise, we will still be doing limited things and trying to expect wonders to work. It will never happen. We have to upgrade our knowledge, and this is for any practitioner, conventional. Even as a functional medicine practitioner, I will not say that I know everything. No, I don't. I learn every day. There are so many tools. There's so much of knowledge still to learn.
This each IVF cycle, what they go through. One, it is a financial burden. Yes. One, it's an emotional burden on them, and then it really takes a toll on their family life as well. So when we are able to give this 4 or 5 step approach,
yes,
how will it look in how someone who's looking at this, if they want to go through that in a systematic way? Of course, they can approach us for help and things like that. Yeah. But if you want to give them some kind of a stepwise program, how will you ask them to follow that, what they're doing?
So the first is give your body at least 6 months time to prepare for a healthy pregnancy. Our body is a very smart system. If the body is not ready, the body will not allow, a new life to house. The bed is not prepared for a pregnancy. It will not allow it to grow, and miscarriages will happen. So it's very important that you give at least 6 months. Now, to start with, we first need to know what exactly is the imbalance. And here I'm not talking about the hormones. Okay. Here we need to know the basics. So you check your complete nutrition profile, all the vitamins, all the minerals. You check for all the organ function. How good is your liver, kidney, your lipid profile, everything. Liver plays a very important role when it comes to hormonal balance. It's the organ which will help in removal of the toxins, in the in converting the hormones to the right metabolites. So if your liver function is not good, again, your hormones will be compromised. So you look for insulin resistance, you look for the other metabolic markers, you look for the antibodies, also autoimmunity markers, because many times we have seen that a woman is just focusing on pregnancy. There are so many other things happening in the body, and that's completely not looked into. If you have an autoimmune condition, you have a leaky gut, how can you expect that inflamed body to house a pregnancy? You cannot. So we have to look at the autoimmunity markers, the inflammatory markers. Check the toxins. Check for the heavy metal toxins, because these toxins, if that's there in the mother's body, it will be passed on to the child. And you don't want to do that. So you'll have to check for that and clear it off from the system. And of course, the mitochondrial function is very important. Because especially in fertility, and any metabolic function is dependent on the mitochondrial function, and pregnancy is a high metabolic demand process. So if your metabolic function is low, the mother will not be able to sustain, the child will not be healthy. So you'll have to prepare the body for that high metabolic demand. So what I do in my practice is get a very detailed blood work done with all these markers. Second, get an organic acid test done. which will help us with the mitochondrial function, the gut dysbiosis, the protein, carbohydrate, fat oxidation, all these details it will cover, and of course the heavy metals.
Yes.
So that's the basic testing profile we do. And of course, understand the patient's whole body sign and symptoms. And then the treatment plan that one, this is for anybody if they are trying to conceive, or for any practitioner who is working with cases like this. The focus, of course, has to be on the diet, right? The diet has to be very clean, a very clean anti-inflammatory diet, which is nourishing, because here we are preparing the body. While you're doing this, you'll be fighting the infections, clearing the toxins. The nourishment is very important. And if there is a bad gut health, that should be fixed. If the liver is compromised, you have to work on that. So the diet is very important. Lifestyle changes. So every possible thing that you can change around you, which will help in the healing process. And this includes removing toxic things from the house. So of course, the plastic exposure has to go away. The exposure to non-stick vessels have to go out, and your personal care products have to change. Your cleaning products in the house have to change, because all these are sources of endocrine disruptors. So these are
and
basics.
Even your electromagnetic frequency.
Yes, yeah. So when we are talking about detoxification, it's also about the digital detox. And especially a mother, or a woman who's trying to conceive, right? And even when she's pregnant, she has to be very careful about the exposure to the EMF, the non-native EMF. So exposure has to be very limited. When you're working on the laptops or phones, you have to use orange blue light blockers. When you're sleeping, you have to turn off the Wi-Fi. You cannot keep the Wi-Fi on and sleep, because the body is regeneration and repair will be affected. And then have strategies in place to get rid of the excess positive charge that you accumulate because of the non-native EMF. So do a lot of grounding, get your exposure to nature, get your exposure to the natural light, move out of the house, do the right kind of physical activity. And with all this, what is also important is supporting with the right supplements.
Yes.
We cannot expect all the nutrition to come from food. Unfortunately, the soil today isn't rich enough with minerals, nutrients. So we have to take the support of certain supplements, so that we can enable the body to recover. Otherwise, it will be a very long process.
All these things, what you're saying, do grounding. Grounding is just walking on your beach.
Yes.
Yeah, which is less than a kilometer away.
Yeah, and in Chennai here, you have the luxury of a beach.
Get your sunlight, just put oil to your head and sit in the sun. So all these things.
Forget the tanning.
Exactly. So all these things which look so simple, yet our patients are sort of unable to follow any of this. And they give us various reasons and excuses, but your health is in your hands.
Absolutely.
And they have to realize that to do this. And when you talk about supplements and things like that, is there anything, are these all nutraceutical supplementation which is over the counter, or are there any specific places where we can get hold of the supplementation which you're suggesting?
So when it comes to supplements, it's very important that whatever supplements we choose are clean label, because again, it shouldn't be like, in the form of supplements, you're also adding, toxic burden on your liver. So it has to be clean label with minimal or no fillers. They have to be optimally dosed. Today you will see the market is flooded with so many supplements. They're very cheap, but then are they optimally dosed? Even a B complex, you will see, it does not have the complete profile. It does not have the enough dosing of each vitamin. And then are they in the active form? So all that is very important. So I think irritation leads to innovation. And that's what my journey also has been in the last 4-5 years. That, okay, when I was looking for testing available, it wasn't easily available. It was just too expensive. Affordability is very important when it comes to any treatment. It has to be affordable, it has to be available. With that, we tried to put together the most advanced functional test together in FM diagnostics. And then when it came to supplements, we were struggling with having the right dosing. Exactly. And the right ingredients together, the right combinations in a clean label. So we eventually had to formulate some of them ourselves, and we did that. So in FM Nutrition now, we've come up with some of the, I would say, the best supplements. We have one of the best B complex with the right appropriate dosing. Then some of the best formulations for liver health, for mitochondrial health. We've been trying to put together these pieces so that we can create an ecosystem where, when we're talking about functional medicine, things also have to be available. They don't have to look up, okay, where now you've told us to take this, where do I get it from?
And most of the time you go online, you go onto Amazon, like you said, when you look at those things, there's one or two things, or the selenium dosing is not appropriate.
Yes.
Zinc dosing is not appropriate. We are not having the right form of magnesium. You
That's
want to use for brain health, but you're getting only a glycinate or something like that. So it really is and you have to think at that level, and to sort of when you're prescribing to FM patients, functional medicine patients. I'm happy that you got your diagnostic tool. So there is a diagnostic side to it, and there's a nutrition side to the FM thing.
Yes, yeah. So we have FM diagnostics, where we have aggregated the advanced functional testing along with very detailed blood work.
Okay.
So now the basic blood work is not enough to understand what's going on in the body. So we have tried to package together very detailed blood work together, which will cover all the nutrition profile, the organ function, inflammatory markers, heavy metals in the blood, all these together along with hormones if needed. And then also organic acid test. So people only know that it can be done only outside India.
Yes.
And it's an expensive test everybody cannot afford. So we tied up with a lab who does the organic acid in India.
Okay.
It's a decent profile which gives us enough information about the gut dysbiosis, mitochondrial function, all the metabolic markers, etc. And then heavy metals, again, used to be an expensive test which is done only in the US.
Yes.
And so we have partnered with a lab in Poland who was able to provide this at 1/4 of the cost.
Okay.
So, and then of course there are a lot of other tests like the SIBO test and the stool test, etc. And we are the hormone test, the Dutch test. So we are adding more and more tests as we are able to find out. And the idea is that we make the journey seamless of ordering a test, getting the kits at their home. And a lot of these tests that I've just spoke about, these are kit-based tests, home-based tests. So a person doesn't have to go anywhere. You order the kit, you get it at home. The team will explain you how to do the test. They will pick it up from your home, and you'll receive the test in a week or 10 days time, depending on which test.
So excellent. That was a wonderful conversation we had today. Is there anything you would like to add, or you would like to tell to our viewers?
So I would like to share about clients who had come to us. She had gone through 4 failed IVF, and when she came to us, she was not able to tolerate any kind of grains, like high levels of food sensitivity.
Okay.
So she was in a grain-free diet for months now. She just could not take any grains. She had Hashimoto, and her antibody markers were very high. And of course, she came to us, that I want to regain my health. Pregnancy is not the priority right now. I want to just, kind of get my health back.
And she hasn't had even one child. She had
no. Yeah, she had failed IVFs. Now, of course, in such an inflamed body, you cannot expect her to get pregnant, and neither was she expecting. So she worked with us for 5 months. And of course, in a span of 1.5 months, we worked on her leaky gut. She was able to take grains, so she could now move on to a gluten-free diet, a very healthy diet. After 4.5 months, she was not only her antibody markers came down, other inflammatory markers got better. Symptomatically, she was doing amazing, and she conceived with twins.
Oh.
Naturally. No IVFs. She conceived naturally, and she delivered healthy babies. That's the miracle our body can do.
That's a truly success story.
Yeah. So so that's about just give your body the right condition, give your body what it needs, and trust in the process that you're doing. That's very important. Whichever treatment you are taking, trust it, put faith in it, and give your body what it needs. And the body is able to heal itself.
That is really, truly a success story. And I wish you many more successes like that. Thank you very much, Dr. Ruhi, for joining us today.
Thank you. Thank you for having me.
Thank you.